We are live right now. Good afternoon. It's October 21st, 2:30. This is Christiana Institute of Advanced Surgery and American Surgery Center. I'm here with one of our surgeons. My name is Kemal Erkan. I'm the chairman of American Surgery Center. Today, we are going to do one of our weekly live sessions, and let me actually just share my screen very quickly. Okay, so everything is ready to go. This is our volume 8. What I mean by that is we are focusing on certain topics each week. I have done 7 of them with 2 of our other surgeons before. Today, one of my favorite people, I do say this a lot, but this time I really do mean it, Dr. Gail Wynn. She's with us. We've known each other for close to 18 years. We've been working together very closely in the last 8 years since 2012, but in total, almost 18 years. Dr. Wynn, if you can please introduce yourself, and then we'll just go to our topic right after that.
Okay, thank you, Kemal. I'm Dr. Gail Wynn. I'm a general surgeon that works for the Christiana Institute of Advanced Surgery. We're a private practice surgical group that specializes in advanced laparoscopic surgery, robotic surgery, and weight loss surgery. We have been doing this for about 19 years now. Dr. Ergau and I started our practice back in 2002, but we started the program for bariatric surgery in Christiana back in 2001 and brought it to St. Francis in 2005. And we are the leading bariatric surgeons in the state of Delaware. We were the first to do gastric bypass laparoscopically in the state, as well as gastric sleeve in the state, and also gastric band.
So, Dr. Wynn, since I have my screen up, I do want to make sure that I mention our other surgeons. As you mentioned, Dr. Ergau, Aziz Ergau, he has done 6 of these sessions with me. Finally, you are here with me today. Dr. Peters did 1 event with me 2 weeks ago, and then we will be scheduling a couple events with Dr. Rahul Singh and Dr. George Ibrahim as our bariatric surgeons. And actually, I'm going to do one of the sessions on the colonoscopy with our colorectal surgeon, since I'm actually approaching to the age of colonoscopy. So we were going to actually talk to Dr. Wade about routine colonoscopy check, and also our wonderful surgical PA, Sydney, who makes it a lot more efficient for us and for our surgeons. And we appreciate everyone who's part of this team. So today we are going to discuss, before actually I start with the topic, I just want to introduce our A team at the Surgery Center. Michelle Ciano is our Director of Nursing, and James Coe is our Practice Administrator. And Melissa Demat, she's our Practice Administrator, and she's one of our Directors at United Medical and CRIAS and Surgery Center. And also Rika is one of our business office resources who's making the experience a lot more pleasant for all of our patients. Now, the other really important team in this is our dietitian and nutritionist, Fran, Amy, and Beth. They're fully specializing in bariatric, as well as the other nutritional areas, but mainly for bariatric, and they are part of this program on a regular basis as we do more and more patients and going through the program together. Now, today, the topic that we want to discuss is the resolution on the comorbidities of after bariatric surgery. Now, because we discussed the surgery and because we have these types of discussions a lot, we as CRIAS, not just in Delaware, but I believe in the United States as a group, we are one of the most experienced bariatric group with Dr. Erkan and Dr. Wynn almost 20 years, and the other surgeons, Dr. Peters is 16, 17 years, and also having that type of mix with where you have different level of expertise and the duration of the industry, they can actually help with the newcomers as well. So I think we have kind of really the best mix from that point, experience with the new technology and new terms. Now, when we ask this, this is always kind of maybe not, we are just really trying to understand and educate everyone. So Dr. Wynn, I'm going to ask you this same question as well. So what makes someone a better surgeon? Like from the time that you finish your residency to the time that you are today, what makes you a better surgeon?
So I think the key to being a better surgeon is experience. It's kind of like same with surgery residency. You get better the more you do. So as we started this program in the state of Delaware, for a long time, we were the only surgeons in the state of Delaware up until about 2 to 3 years ago that did this surgery. So we've had a tremendous amount of experience, not just with initial surgeries, which is band, bypass, and sleeve, but also things like revisional surgeries, taking care of patients that have any type of problems inside their abdomen, because weight loss surgery laparoscopically is actually one of the most difficult laparoscopic surgeries to perform. And when you could do it, and you could do it well because you had a tremendous amount of experience, then you could pretty much deal with anything within the abdomen. And so people that have had multiple surgeries in the past, they ask us frequently, like, will this interfere with my weight loss surgery? And oftentimes we look at that and say, no, this is our specialty. This is what we do. So we've probably done over 10,000 weight loss surgeries in the past 19 years. So we've had a tremendous amount of experience between our group.
That's an amazing number. Like 10,000 is not just some random number. So it's in bariatric surgery and any different types of bariatric surgeries we have done. And I'm actually proud to be part of the group, and being able to trust our surgeons is extremely important. So thank you for making this a lot more enjoyable. Now, Dr. Wynn, we are going to discuss the resolution on comorbidities, as many of our followers already know, our patients. But I wanted to ask you if you can just educate us on the comorbidities. And because we are going to take this to the resolution, let's actually just discuss the comorbidities first, and then we'll go to the resolution.
Sure. So many of our patients that come to see us have sleep apnea, and they don't even know it. Over 50% of our patients actually have sleep apnea. And sleep apnea is basically where you stop breathing while you sleep. And the reason why is because you just have really heavy chest wall, or a lot of fat in the back of your throat. And so what happens is it basically stops you from breathing. And when that happens, even though it's for a brief moment, it could actually cause your arrhythmias and help you, cause you to actually die in your sleep. So we actually want our patients to know whether they have sleep apnea or not, so we get them tested for it, because we actually had more people die of sleep apnea before they even had surgery than people that have actually died from surgery. So it's very important that we find out whether you have this disease, treat it, and as you lose the weight, it actually goes away. But we want to make sure that we make surgery safe for you, and we want to make sure that you actually have a healthy perioperative experience. Heart problems is also very common with our patients. About probably half or more of our patients have high blood pressure. You combine that with diabetes, and then you're basically looking at a person that's born with a heart problem. And those things go away also as you lose the weight. When you think about diabetes, type 2 diabetes is something that's really become more common in the last 10, 15 years. And about 2/3 of people with type 2 diabetes are overweight. So when you look at these things, diabetes, high blood pressure, heart problems, sleep apnea, high cholesterol, If you look at all these problems, if you actually help someone to lose the weight, these medical problems go away. If you just treat the disease, you spend thousands and thousands of dollars monthly trying to treat these diseases, and you're not really actually getting rid of them. You're just kind of helping treat the symptoms. Cancer is also a big thing. Patients that are overweight have a higher risk of cancer, about 4 times higher risk of cancer than someone of normal weight. And that's just not, there's a lot of cancer. So there's pancreatic cancer, there's colon cancer, there is uterine cancer, there's prostate cancer. So a lot of different cancers occur and make you higher risk when you're overweight. If you kind of get rid of all these medical problems, you become a much healthier person.
So the way that where we actually started with the obesity, how it was not even recognized as a chronic disease or as a disease, and where we are today, and with all the resolutions that we are hoping to get, just from the simple, like from the patient side. So sometimes everything that we say, it may be a little bit overwhelming, but I was hoping that this diagram just kind of makes it easier for us to understand. So when we say the main resolution that we are hoping to get, so it's in 4 different groups, type 2 diabetes, hypertension, sleep apnea, and hyperlipidemia. So now, can you, I know you're going to explain how much or how these things are happening and how quickly these things are happening. And I do want to give you one statistics from American Surgery Center side. Last week when we have this session, we did actually go through the patients who have completed their 12 months. And the BMI reduction range was anywhere from 32 to 36%. So that's a great number, and we are so happy that that's happening. But now tell us how these are disappearing from this point.
Yeah. So as people lose weight, medical problems go away. And you could see this poster. This was from Cleveland Clinic, and it's quite indicative of the medical issues that can occur when someone's overweight and how they resolve. So believe it or not, migraine headaches go away about 50% of the time as you lose weight. Pseudotumor cerebri, which is morning headaches because you're overweight, actually goes away as you lose weight over 90% of the time. And so when you go see a neurologist and you're overweight and you have these morning headaches that are due to pressure in your brain from being overweight, their first thing they're going to tell you to do is lose weight. And oftentimes now bariatric surgery is recommended as first-line therapy for pseudotumor cerebri. High blood pressure goes away over 60% of the time. High lipids goes away over 60% of the time. Fatty liver goes away over 90% of the time as you lose weight. And fatty liver actually is something that could be very serious. Fatty liver, if untreated, can lead to cirrhosis and long-term liver failure. Type 2 diabetes, depending on which surgery you have. So if you have gastric sleeve, it goes away over 75% of the time. With the gastric bypass, it goes away over 90% of the time. Polycystic ovarian syndrome, which happens a lot in women that are overweight, where they can't lose weight, they start growing facial hair, they can't have babies, they become infertile. That goes away over 100% of the time when they lose weight. Venous stasis changes, so changes in your legs from having bad veins, that goes away as you lose weight. Gout goes away about 70% of the time as you lose weight. Sleep apnea goes away over 75% of the time as you lose weight. Asthma improves. Heart disease, you have an 80% risk reduction. Reflux goes away, usually about 99% of the time with gastric bypass. With gastric sleeve, sometimes it gets worse. Stress incontinence goes away over 50% of the time as you lose weight, and joint disease goes away over 50% of the time as you lose weight. So if you think about it, as you lose weight, all these medical issues go away. Oftentimes, people's medications don't need to be taken anymore. And as a matter of fact, usually within a year, year and a half, many people are off their medications.
Now, just to take actually, maybe just going to the focus of these four. Now, why we are also, like from my side, like I'm not a surgeon, I'm not a physician, but I'm part of the program. So what I know about these four comorbidities are, they're also making the BMIs between 35 and 39.9. With one of these, the patient become eligible for the bariatric surgery. So that was like one of the reasons that most of the non-clinicians, we know this, and we have to kind of remember these diagnoses. So, but from the resolution side, many of these issues are disappearing. This actually, just so that we can see it in percentages, either resolved or improved is over 78% to 86%, and then resolved actually between 62% and 83%. Now, these numbers are extremely strong. Now, maybe you said it, and I don't know if I missed that, but when someone can expect these resolutions, like average, like is it like 12 months or 18 months or 24 months?
Yeah, it's usually within the first year after surgery. Sometimes diabetes can go away with patients that have gastric bypass, oftentimes before they even start losing a significant amount of weight, just because of the way the intestine is rerouted. But usually it takes about sometimes as early as 6 months after they lose weight to get rid of their medical problems. A lot of it depends on how much weight they lose during that span.
Now, one of the discussions, again, we had last week, I'm making a reference to the last week because there was some stuff that came out. Now, after the surgery is extremely important, although we put a lot of emphasis prior to the surgery because of some insurance companies, they are making it difficult for patients to get this, although the risk of this surgery is not any worse than gallbladder surgery, but patient has to get so many clearances and so many requirements, but we help them, and maybe we are trying to kind of emphasize that part prior to the surgery first. But then in order to get these resolutions, we have to make sure that patients are following up with you and our nutritionists. Is that like how much of that is actually helping with the resolution?
So we expect lifelong follow-up from our patients, and we follow up patients pretty frequently in the first year. So we see them at 2 weeks after surgery, 4 weeks after surgery, every 3 months the first year. And the key to success is really follow-up, because if you're kind of going off track, we are there to kind of help you get back on track. And the other thing is also during that time, we do things like check your blood pressure, check your blood work to make sure that you're not having any ill effects from losing weight rapidly. Really, weight loss surgery, the key to success is not just the surgery itself, but it's what you do afterwards. And the surgery is just the beginning of the journey. After what you do, it's a lifelong commitment, and we're there every step of the way to help you through. But we can't help you if we don't see you. So, every 3 months the first year, every 6 months the second year, once a year after that. And if you're struggling, we see you very frequently. And there's patients that we see every 2 weeks just to make sure that they stay on track.
What I told Dr. Erkan last week, because patients do, focus on getting the surgery part, and they go through so many different appointments. And after especially once they start losing weight, so the first thing they do is they don't show up for these appointments because they are, so maybe like tired of going through doctor's offices, and they don't want to be labeled as a patient. And I was proposing if we can actually even maybe call the after the surgery part as like a wellness program rather than calling the individuals patients, but just like a wellness program members. So then they don't maybe feel like a patient because they have done so much to get the surgery, and then 12 months they already lose 36% of their BMI, and then they feel great. Like they're like, well, I don't want to go to doctor's office anymore.
I
So,
think that's a great idea.
so now,
The wellness spa.
so Dr. Wynn, the other thing is happening these days is that uh, because of the COVID-19, the telemedicine, telehealth is a big part of our practice. If you can maybe just give us a background or feedback on how your experience is, what you are going through with the patients, and how much of the telemedicine you are doing versus how much in-person visits you are doing.
Yeah, I think I'm doing about 90% telehealth. And I find it to be very useful. I think our patients absolutely love it. And the main reason why is time. You know, it takes time for you to travel to the office. It takes time for you to wait in the waiting room. It takes time for you to be seen. And then after that, you still have to drive home. So a visit with a physician can take anywhere from, you know, an hour to maybe 2 to 3 hours, depending on how far away you live. With telehealth, it's very easy. It's a click of a button. Although there is some steps to it for getting checked in and being seen, but it really is just a click of a button. You just answer a text and you're on a screen and we can visit with each other. I could do things like see your incisions, see anything that you want to show me that might be bothering you. And so it actually has been very useful. If things say like you have a hernia and I can't see it via telehealth, I'll bring you into the office to be seen. But usually lots of things can be done via telehealth. There was a woman that was concerned that she had an infected incision. And so I actually telehealth with her immediately. And I called her up, I said, telehealth with me, and we'll take a look at it. And it was just bruising. And she was so relieved. And so it just makes it very easy. It actually helps with compliance. So people are willing to be seen more frequently and on a regular basis because it's not a hassle to come in and be seen.
So because of the some of the maybe I do believe that telemedicine is a lifesaver during the pandemic, and I also believe that it should be long term. It shouldn't be just for the time that we have this pandemic, but it should be something that we should be utilizing long term. And in order to keep the longevity of the telemedicine, our United Medical ACO, as CREAS is part of this, and with the CREAS efforts, we actually spiced up our YouTube channel. We were doing a lot on the Facebook, but we realized that some of our patients, they do like the YouTube better in terms of watching these videos. And I personally spend a lot of time with my team. Of course, this is not just me, but of course, if the surgeons are not there, none of these would happen. But with what I'm able to do with our marketing team and our business development, like right now, I have 3-4 people who are watching this event closely, and then the same thing at Dr. Wynn's office right now. So we try to make this where we can provide these videos in a good quality and good content, and everyone is able to follow and understand and use it as a supplement. So this kind of like brings us to the term that I've been using as the integrated digital health digital record, so that you see the telemedicine, you follow up with us with telemedicine, and we are also providing everything very openly on these videos, and we categorize them, file them in a nice way, label them in a nice way, and they are no longer, I mean, not longer than like 30. Well, in the beginning it was a little bit longer, but we learned to keep it under 30 minutes. So please, take advantage of these. These should complete the care that you are getting from us, regardless of telemedicine or in person. But I do believe that these are really helpful for our patients, and I do know that they are actually watching so many of these videos now. The other thing is that from the surgery center and CREAS side, we have, this is the 3rd month in a row, we have 100% patient satisfaction score. Patients who have surgery, who recommends us, not only they just recommend us, but they actually name our nurses with their first name in these surveys. And this is extremely important, and we are very happy to have these outcomes. Now, From our side, again, we are here to help. How we can do this for you, how much effort we are putting out there with the team that we have, from the surgeons to everyone in our offices, anyone in between. Even during the pandemic, this actually makes it a lot more important for us to be more efficient and more visible for everyone. Now, Dr. Wynn, I don't know if you have any closing comments. As I promised, we are getting to the 30 minutes.
Actually, I just want to say to everybody, good luck in your journey and with what you decide to do. Weight loss surgery really does help people, which is why, 20 years later, I'm still doing this.
Well, that's really important. And, I do want to mention that, someone like you who's part of this program, not only as a surgeon, but as a mom, as someone who does Iron Lady and a lot of crazy stuff, Iron Man, Iron Lady. So I admire you a lot personally, and I'm so happy that you're part of this organization. And thank you for taking time for today, and then thank you for being with us. And we'll see you soon. And next week at 3 p.m. we'll be back with another topic. Thank you so much.